and thank you for taking the time to watch my clinic video. I decided to make it to help alleviate the fears some patients have about having acupuncture. It shows every step of a typical treatment, together with the equipment most commonly used. Hopefully, having seen it, you will feel more at ease about choosing acupuncture as a natural way to restore and maintain your health. When my patient first arrives, we spend 5 minutes talking about the condition they want acupuncture to help them with. Before treating my patient, I will already have conducted a traditional diagnosis, which is a 2-hour consultation during which we discuss their current health concerns and medical history and carry out some simple diagnostic tests. Before each treatment, I always check what has been happening since either the traditional diagnosis or the last treatment. I then invite my patient to lie down on the treatment couch and I spend a few moments taking their pulses. This is similar to the way a GP takes pulses, but we take them on both wrists in 3 different positions and are feeling for the quality of the flow of qi as well as the pulse rate. Having gathered all the information I need to determine which acupuncture points to use in the treatment, I mark them up on the patient's body using anatomy and palpation to accurately locate each one. Where it is appropriate, I treat the patient with moxa before needling. This warms and invigorates the qi and blood. Moxa is a variety of the herb Artemisia vulgaris, commonly known as mugwort. It is either placed directly on the skin on the acupuncture point, or waved above it using a moxa stick. When applied directly, the moxa is formed into small cones and placed on the acupuncture point with a dab of water to help it stay in place. It is burnt down to when the patient feels a warmth on their skin. The moxa cone is then immediately removed and is never allowed to burn down onto the skin, so avoiding burning and scarring. The smoke from the burning cone is beautifully perfumed and adds to the therapeutic effect. For those patients with chest conditions, a smokeless moxa is used. Once the moxa treatment is completed, I'm ready to needle the points. Before touching any needle, I wash my hands in accordance with the British Acupuncture Council's Code of Safe Practice. Only pre-packaged, sterile, single-use needles are used. They are filar-form, meaning thread-like, stainless steel needles, and are solid, not hollow like hypodermic needles, so no substances are introduced into the body. The most commonly used needles are either 1 inch or 1.5 inches in length, and 0.2 to 0.3 millimeters in thickness. The average depth that needles are inserted is between 2 to 5 millimeters. At no time do I touch the shaft of the needle, using cotton wool to act as a barrier and to support the needle as it is inserted. The patient occasionally feels a tiny prick as the needle is inserted, and then more often feels a dull ache in the acupuncture point, which means the needle has engaged the qi. After needling each set of points, I take the patient's pulses again to check that the treatment has had the desired effect. Once I am satisfied, the treatment is concluded and the patient gets dressed and leaves.
You can go. I'm going to walk you out. Okay, all right.
If you have any questions from seeing this video, please contact me and I will be only too happy to answer them.